Hey gang, welcome to another episode of Try Not to Curse. I am really excited because my buddy Bryan is here with us. He and I met through Mike Ron Steve, as you all know, good friend of the pod. And I've been trying to get him on here because he has two very unique jobs, and they allow him to travel. He has seen the world. He is a jet setter. But he also has some funny stories of the things that he's experienced along the way as well. So Bryan, thank you so much for joining us. I so appreciate you.
It's been a long time coming, and I'm so happy to finally be here.
Oh, you're the best. So what do we talk about first? So you have a background in the medical field. You've been in nursing. You've been in private healthcare. But you've also recently in the past couple of years, I want to say it's kind of like become like a pandemic job, maybe stemmed from the pandemic, have become a flight attendant for a major airline. So which one do we want to delve into first?
I mean, you've been nursing longer.
Yeah. Well, so what got you into the nursing field? Like, were you always just interested in a specific, medical field, or just helping people in general, or you just felt like you kind of had like a knack for caregiving?
Well, it was kind of a moment of opportunity, because I went for originally my bachelor's degree was in microbiology.
Oh, okay.
I worked in a food safety lab. So I was the deputy director of food safety lab, and pretty much never want to eat food again if you realize what it has to go through.
Don't tell me that.
And yeah, so just to make that job as concise as possible, we would raw a sample of food in a pool of its own bacteria and test that for any kind of like foodborne pathogens like Listeria, Salmonella, E. coli, and make sure that it's safe to send out to the general public. And I to this day, I can still am reminiscent of all those smells and everything of food rotting.
Oh.
So, yeah, it was a moment of opportunity when I got the chance to move home, and I decided that I was like, I'm not fulfilled, and I tried enrolling in a nursing program, and within the first semester, I decided it was for me.
Okay, that's great though. Was there any particular concentration, like pediatric nursing or elder care, or I don't know how it works in that regard, or is it just kind of like a blanket, like just learn to put in IVs and that kind of thing?
So actually, a random aside on that, they don't teach you IV work in nursing school, because it's such a specific skill, and every facility you go through uses different supplies and have different policies on it. They expect to learn it on the job. So I did 0 IVs until I was in the field.
Oh, that's wild. I would think that's like day one, because to me, I feel like that's so common.
No, it's something you learn on the job. I mean, granted, I'm grateful that I've become very good at that skill.
Yeah.
But no, it's something that you have to learn, because if you learn one way, then another company might not do it the same way. And for instance, the outpatient clinic I work for now used a different type of IV catheter that I did not care for at all.
Okay.
And me and one of the other charge nurses got together. We're like, why do we use these? And we actually got the practice to change to a different type of IV catheter.
Oh, that's great.
That I'm used to, that I've worked in every facility, and I believe is a higher quality. So I'm like, because I like it, you all have to like it. Which is
hey, you know what? That's pretty much my philosophy at my job as well. And I always joke around with people. I'm like, listen, if it makes me happy, you're better off. So.
Liz, this is why you and I are such good friends, because we both know quality.
Exactly. Thank you. Exactly. That's too funny.
I mean, come on. You and I at brunch together killed it. Nailed it every time. But anyways, so how nursing school worked for my program is that you kind of rotate through rotations. Your first rotation generally is either a long-term care, which coincidentally I ended up avoiding, and went into an LTAC, which is a long-term acute care hospital. which is different from it's if you think of like a hospital, like anywhere with like an ER and stuff, that's an STAC. It's a short-term acute care. You are there for a short period, but you need a high acuity level of care. So an LTAC is a long-term acute care. You are very sick. You need that higher level of acuity, but over a long period of time. So for our patients to even qualify to stay with an LTAC, you needed a 28-day stay at the bare minimum.
Okay.
So that was my first rotation in nursing school. And my first patient that I kind of really got in touch with was this elderly woman with metastatic breast cancer who really bonded with me and one of my other coworkers. And whatever, we ended up saw her a couple times during our rotation, but we went on with other patients. And I remember our last day of that semester, our nursing professor was like, you know what, give her the best day you possibly can. So me and my coworker or my classmate, Lisa, went and we gave her the best day ever. Like we spent all this time. Her husband loved us being there because she loved us so much. And we even had, I had pre-ordered her like a little bear that was dressed in scrubs because she always asked every single week after she met us, like, oh, when are Bryan and Lisa coming? And we're like, oh, they're students. So we gave her this bear that when you pressed the hand, it would sing the Jackson 5, I'll be there.
Oh, cute.
So it'd be like, oh, we're there. It was dressed in like little pink scrubs, a little stethoscope. It was adorable.
Aw, that's awesome.
So Lisa and I always talked about it like, oh, let's go see her before we start our second semester of nursing school. And around New Year's Day, she had passed.
Aww.
And we were informed about it. So we're like, okay, let's go to the funeral. So we were at the funeral and we found a little spot together and we're just waiting for the funeral to happen. And the woman's husband walked in and he's just walking up. And then he saw me and Lisa in a pew off to the side and he almost collapsed crying, being like, oh God, I'm so glad to see you.
That's so wonderful.
And the celebration of life happened, and then the family didn't let us go. They're like, you're coming to the reception afterwards. So we were with the family, and one of the nurses that actually worked at the hospital told us when she was actively passing, they would play the recording on the bear, and her mouth would respond to it. She would start to kind of try to sing along. And that was the moment I knew that nursing was for me, that it has so much power to be there with patients when they're at their most vulnerable. And it's not even about the patients, about the patient's loved ones. And I never looked back from there.
That's so beautiful. I know, as from my own experience, my aunt and uncle have been in and out of the hospital for years. And my aunt was the type of person that, everybody in town knew her. If she developed a relationship with you, like every holiday time, oh, I had extra bananas, so I made banana bread, and she'd drop it off at the pharmacy, or she'd drop it off at the doctor's office, the reception area, whatever. So because they were in and out of the hospital all the time, she was constantly bringing them baked goods when she was visiting her husband or after she got out from whatever procedure she had going on. So when she had passed, like, the whole hospital was like devastated because they had same thing. They had this relationship with her and they had known her. And I think the medical field kind of gets a bad rap, especially, with all the crap with insurance and whatever you have to deal with your job and the paperwork, and it's very stressful. And of course, nobody wants to be there. But at the end of the day, when you make that connection with a patient or with your nurse or your doctor, it makes all the difference. And it turns an uncomfortable or an upsetting situation into, it's a little more palatable, and it's you can get through it when you feel like you really are being cared for. So that's really wonderful that you were able to make that kind of connection with someone.
But it's true of any industry. There's the people that are bad in any industry, but a lot of nurses go into it because they care about people. And I forever hold on to those good moments that I either advocated for a patient that didn't have a voice, or it was my intervention that changed the outcome for the better, or made that patient so much more comfortable as they passed on. Because a lot of nurses want to be in like maternity, labor, delivery, be there at the moment where life begins.
The cutesy, the sweet, the innocent. Yeah. But I mean, some rough shit happens in that area as well.
Yeah. Oh, it does. And for me, that's not I could not deal with a child or a baby that could not make it, that didn't get a chance to live their life.
Yeah.
I find peace in helping somebody that, lived their life, and then I gave them a peaceful and dignified death, because I have been there when people are transitioning, and it's because of me that they died comfortably and beautifully, and the family has peace. And I would choose hospice 100 times over being over in labor and delivery.
Yeah. Oh, that's really sweet though. That's really, and that's, and again, that's what any of us could hope for, right? Is just a peaceful transition. So that's really nice to hear. So you've worked in a number of different states in the nursing field. Do you have to go through a different like certification process from state to state, or like once you've got your nursing degree, your license, I don't know what the terms are, can you basically just kind of float around and say, oh, I see they need staff in Montana, I'm going to go work in this hospital? And how does that work?
So funny that I mentioned Montana, because I happen to know that's a compact state.
What does that mean?
For nurses, your initial qualification. So when your initial licensure and everything, so you sit for your board certification, which is the NCLEX, the NCLEX. That is your certification to become a nurse.
Okay.
So once you graduate from a nursing program, whether it be at a community college with a 2-year degree or at a university with a 4-year degree, we sit for the same NCLEX and receive the same certification. So if you are certified and pass through your NCLEX, then you are certified to become a nurse and licensed.
Okay.
So you become licensed in whatever your primary state is. I currently live in Maine. So my state is a compact state. So there is something, the NLC, the Nursing License Compact, that if you are in a compact state, your license transfers to other compact states without having to sit there and wait and apply. So you don't have to sit for another test or anything. So say if I wanted to go to California or New York, I have to apply for certification, pay, X amount of dollars, meet their criteria, wait for them to approve it, and then wait for licensure to be able to practice.
Okay.
When you are in a compact state, say, okay, I'm going to go to Montana. There's a hospital that needs me out there, and I'm in Maine with a compact license. Mine instantly transfers over because my primary state's a compact state, and I'm able to practice in that state as long as I maintain the licensure, requirements of my home state.
Okay.
So a lot of states are compact states. There's still probably a handful that are not, but it is a push to get as many states on the nursing license compact so nurses can move where the need is.
Well, you would think so, right? Because we keep hearing about how there's such a need for nursing. There's such a need in the medical field for staff. So you would think more states would want to make that easier for people to come and to join the staff, to help out, to lend a hand, and to fill these vacancies. What is there a benefit to being a compact versus the other, or is it just kind of their preference and they really just haven't caught up with the times?
I think, just in my opinion, I think the only benefit to staying outside the compact is that it generates more revenue because those nurses will have to apply pay those state fees and wait for licensure. Whereas when you're a compact, you can swing right into that state, work. And if you decide to I want to live here and move here, then you apply, pay your fees, and that becomes your primary state.
Okay.
But in terms of being able to swing into a compact, you don't pay the fees up front like you would in a non-compact state.
Okay. So how long have you been in the nursing field now?
I graduated in 2016.
Okay. And you've worked in Maine, you worked in Connecticut, you worked in Massachusetts?
Yeah, and California.
Did you work in Texas at all? I know you were traveling,
I did not.
No, okay. So you were working in hospitals the majority of the time? And then you got into private care?
The private care is so still some of those states, but yes, the private care was separate from working in acute care. But a bulk of my experience has now been in outpatient, which is where I currently work.
Okay. What brought you to the private nursing? Did someone just come up to you and say, "Hey, we've got this opening," or did you hear about it? How did you get into that aspect of it?
It was just an opportunity. I honestly didn't even believe it was a real job. It was it's
something you only see in the movies, right?
Yeah, exactly. It was, so it's a field of concierge nursing. So it's separate from private nursing because it's concierge. Fancy. You're working with the elite clientele. And it was a great friend of mine, Amy, that I've known for over a decade, who also was a nurse, and happened to meet a recruiter at a Medi Spa who just happened to mention that. She goes, I really need male nurses for a client of mine. And she goes, oh, my friend Bryan, he's fantastic, and referred me. And honestly, I went into it so hesitant. Every step of the process of applying to this job, I'm like, all right, I'll move on. Whatever. And then even when I went to work for the first time, I had left my job and they're like, yeah, go try it out. If you don't want to, just come right back.
Yeah.
And I went with no commitment to it. And it's wild working in that field.
Well, and obviously we can't talk specifics, but did you prefer it to working in hospitals? I mean, you get very one-on-one time with your one specific patient, but at the same time, that I would imagine that kind of can end up feeling kind of like babysitting sometimes as well. Whereas, your day is a little more broken up when you're in a hospital seeing multiple patients. Yeah.
But I guess it's kind of like any job. You make your gratification and everything. And I always choose to work with the highest level of integrity and professionalism. So I always found my satisfaction. So even working with one patient for such a long period of time, I grew to know them. I knew their families. I found where I fit in and made my purpose known. And I always work to the highest level of my ability, regardless of what I do.
Yeah.
So I love every job I've had, and I can look at any job I've had and be like, here are my highlights, and this is how they're better for me being there.
That's wonderful. That's really wonderful. I will say what I do love about people in the medical field is you have seen it all. And we've had a couple of doctors on the show already, and I love that I can just talk about any and everything. Like, I think the last time I saw you, we picked you up from the airport. We were all staying at Micron Steve's, and you guys were talking about gastrointestinal stuff. And as we know, Micron Steve does not want any, he does not like poop humor or fart humor. He doesn't like anything to do with the digestive, he won't even, I went to show him an x-ray and it's just bones. And he was like, oh no, I can't. I'm like, what? Like, you're cringing over bones? A picture of bones?
You can't even say the word poop without him being like, nope, I tap out of this conversation.
Right, exactly.
What's my safe word?
Exactly. So I love getting together with you because I feel like I can just have open, honest conversation. Not that I'm saying here, diagnose, I have this weird stomach thing going on, but it's nice to be able to just be open and honest about a BM here or there, whatever. and it doesn't faze you.
I have to be like, how is the consistency? How often is there cramping associated with it? Is there bleeding and mucus?
Well, you know what it is?
It's so that all the time.
You know what's so funny is I think so when I had my bariatric surgery, it was the first time I ever spent an overnight in a hospital. But I had kept hearing from people, like after certain procedures, they won't let you go home. They won't clear you to leave until you poop. But me, my circumstances, obviously my stomach was completely empty at the time. And then they took 80% of it away. So obviously that wasn't happening and they wouldn't feed me. And I kept being told like, oh, you can't have ice chips yet. You can't have ice chips yet. So I'm thinking, okay, I know I have to pee. That's really important. They want me to get that first pee out. And now now listen, my listeners know there's nothing taboo here. So I apologize sort of, you guys, but also this is just real talk. So I got my first pee and I'm thinking, great, I'm going to have ice chips at any moment. They're going to bring me ice chips at the very least. My lips were killing me. It was had this whole thing. No ice chips. I peed again. And I'm like, okay, you guys clear. I'm flushing it all out. I've got it all. Like, now we can start the ice chips. No ice chips. I farted. And I was like, oh, maybe that's what it is. Maybe because I can't poop. I know it's not happening. I'm not going to be able to poop. Yeah. So I literally called the nurse and I was like, I just wanted to let you know I farted. The nurse was like, okay, like that's what you're calling me. But I didn't know. I was just so desperate. It's, I was like, and believe me, I had heard it the whole night of people calling like, I need my meds. Can I have my meds? I felt like I was that, like, I was like, please, the ice chips. I just want, like, what do I have to do to get ice chips? So I thought, okay, well, I keep hearing you have to poop. So I told her that I farted thinking that I was going to make a difference in my world. And sadly it did not, but what are you going to do?
Yeah, for me, it did make a difference because I was like, okay, that means there's active motility in your colon.
Thank you. I'm just giving you the update. That's all. You know what I mean? Oh, my God.
And after bariatric surgery and being around in there, you kind of want to make sure stuff kind of goes back to normal. So
thank you.
I care.
Well,
I care about you farting.
Well, and I also, I'm one of those people, like, I try really, really hard to, like, not inconvenience anyone or not be like too needy or anything. So like literally the only time I called them was when I had to pee because I needed help getting in and out of bed. And then when my IV would empty, there would be like an alarm that would go off. So I would just be like, there's an alarm. Like, I don't know what things are. There's an alarm. Okay, fine. And then they would just come in, middle of the night, whatever, do their thing. But I was trying so hard to like not be a bother, but at the same time I was like, give me ice chips, please. Oh my God. But and I don't know how to word this, but so again, so I was there that night and I kept, this one woman in particular just kept constantly, meds, I need my meds, and they kept saying to her like, no, it's not time. So like, what do you do when you have a patient that like that and listen, I recognize that everybody has different pain thresholds and some people, you can't just suck it up. And, that's what I was thinking. I'm just laying there. I'm like, lady, just lay it, like, just, but I don't know. But a lot of the time, is it people that are genuinely in pain, or are they people that maybe they're just kind of like panicking and they're thinking this is the only thing that will make me feel better? Or is it people that are, looking for a next fix? Or I don't know how to properly word this question, but what do you do when you get a patient that's particularly difficult or demanding?
So in terms of, from my personal perspective, but I mean, me well, I'm a very compassionate person. In terms of being,
but you're also very like cut and dry too. Like, listen, lady, you got your meds at 3, you gotta wait till 6. I don't want to hear it again. Like,
Yeah. So in terms of that kind of stuff, so I remember I had a patient who, he had an IV morphine push. And the order was for every 3 hours. He would set an alarm on his phone, would hit his call bell at 3 hours and ask for it. I am not able to tell you what your level of pain is or anything like that. A doctor provided me an order. If there is no reason for me to give it, I'm going to give it. So if you are breathing, because narcotics can, suppress your breathing, your respiration. So that's a huge red flag. Like if somebody were barely breathing, I'm not going to give them an opioid.
Okay.
So, I mean, if you are alert and oriented, you are breathing, there is absolutely no contraindication for me to give it. I don't care if you were sitting there laughing on your phone, you don't look in your pain, I'm going to give you your medication. I am not here to judge. I have worked with nurses that judge and be like, oh, they used heroin. They're just looking for a fix. That is not for me to judge. They're, on the other side of it, they have used, illicit drugs. Their pain responses are going to be completely screwed up.
Right, sure.
I don't understand their body. I go by if there's an order and if there is no medical reason for me to hold it, I'm going to give it. So if you were not breathing, comatose, if you're, I'm not going to go in there, you're sleeping, and because it's been 3 hours since the last time I pushed it, no, you're not going to get it then. But, so that's kind of like my take on it. I take the whole person approach.
Yeah.
And there's always difficult patients in a hospital. You're seeing them at their most vulnerable.
Yeah.
So they're going to use their defensive mechanisms. They're going to take it out on you. And I never took that personally.
I always equate it to like working retail. Like you don't get a say in who walks through those doors. You have no control over what your day is going to be like based on who's there. But at the end of the day, your job is to take care of them to the best of your ability. So yeah.
I always have.
Yeah. That's wonderful. Oh my, but I cannot imagine the things that you have fucking seen. Oh my God.
Oh man. I mean, seeing people's like spinal column through like an abscessed wound, a gunshot to the top of the spine.
Oh my God.
I had somebody run from the cops after beating their spouse and they were shot at the bottom of the spine and became a paraplegic. Like I've seen some things and it's kind of nice being outpatient.
I would imagine. Well, let's talk about that. Let's talk about when you get, a quote unquote bad guy that you have to treat. I mean, we see it all the time on medical shows and movies and things like that. And just like you said, like they want to judge and they, yeah, we're here to do a job, but fuck this guy, like whatever, why'd they have to bring him here, whatever. How do you do that? How do you give, the same amount of care and consideration to someone that is not a great person and maybe has done some horrible things and whatever circumstances led them to you? How do you turn it off, I guess, really, and just treat them like you said, like you would anybody else, treat the whole person? How do you do that mentally?
But we really should be treating the person, never, ever, ever judging them for their background. I remember one patient I had, he was being tracked by the FBI for running a ton of drugs through New England, and a rival gang came, shot him at the top of the spine. He became a quadriplegic, had no feeling past the top of his shoulders, was completely dead from the shoulders down. Wow. Was on a tube feed, he had to be trached on a ventilator, so he couldn't even talk, had a machine breathing for him. And it was difficult there for a while because, he was this massive, muscular, just big dude. And it was like hard to roll him, to do care and to make sure to stay on top of it. But eventually we were able to, do enough rehab so he could breathe on his own. And I was with him for a while. And I remember one day I was in there just scanning his meds, getting it ready to, standing at the computer, scanning, getting him ready to pass through his G tube. And he just like looked over at me and he goes, "Hey, did you eat today?" And I'm like, I'm good. He goes, I got honey buns in the bottom drawer. Like, come on. He would not let me leave the room until I took something from his room to eat, and being like, "Oh, no, I'm good. Like at the end of the day, it's the human experience. I do not give a single fuck about what you did. to get to this point. I'm going to take care of you because you're in my care. And I knew my patients appreciated it.
Yeah.
And it was always gratifying when I was able to have some of these patients that were, you know, admitted for shooting bad heroin, blowing out heart valves, and needing long-term antibiotics, and never seeing them again. Because we had some frequent flyers that, you know, would blow out a heart valve, need long-term antibiotics, and, you know, be back in our unit 6 months later. But there were some people that I was like, all right, you know, we changed them. They're not here. They're at least safer. They're at least using clean needles, whatever the case may be. They're not here with us, and we changed them for the better.
That's great. I definitely want to get into the whole flight attendant thing and talk about that experience. But just while I have you, because I always pose this question with anybody in the medical field that I get on the show, insurance. How much of a pain in the ass is trying to do your job, trying to take care of a patient, and having to deal with insurance? And why? And why?
I know this is like try not to curse, but fuck insurance. It is the worst, because sometimes you just want to do stuff and you're like, oh, do I have a prior auth to do this? Oh, is this okay? And there's like certain providers I work with now, and I've been asked like, oh, if you had to see, you know, a certain doctor in your practice, who would be? I'm in like, this, and this person, because I've seen them call up insurance companies and start screaming. I remember I was in between procedures, and one of the doctors called up insurance company being like, how dare you deny my patient this medication?
Right.
You are going to be paying for it when they're hospitalized. I'm authorizing this on an off-label use. I'm the doctor. You better fucking do it.
Well, that's what I never understood. If a doctor is coming to you and saying, this is what my patient needs, who the fuck are you to say no? Bill whoever you got to bill for whatever amount you got to bill, whatever. But who the fuck are you to say, actually, we don't think they need that? Or there's this alternative, we'd prefer them. What the fuck? Like, and I've, you know, like I said, I've talked about this on the show before as well. I've challenged that myself when they've said, oh, you need this, or, you know, we can't. And I've said to them, okay, I'd like to speak with the doctor. And they said, what? I said, I'd like to speak with the doctor that's telling you my doctor is wrong in my diagnosis and my care, and telling you what, you know, what order I need for the prescription, whatever. So I'd like to know what doctor you're speaking to and what their medical field, and they're, well, no, that's just, well, then what the fuck? Then what medical school did you go to that you get to justify denying somebody this care? Or, you know, it's just so crazy to me.
I remember when I was younger, I was a teenager. I was at a family event. It was stupid. My uncle and I were roughhousing, and I ended up with a broken jaw.
Oh, jeez.
And I remember, you know, I was in high school. My dad was screaming with the insurance company because it was a broken jaw. So like the dental insurance didn't want to cover it, but the medical insurance didn't want to cover it. And they were like fighting between the two until it just happened to be one day I was in school. They finally figured it out. And I just remember somebody from school coming being like, oh, you're being pulled out of school for surgery.
Wow.
I finally got, you know.
But you were going to school with a broken jaw?
Yep.
Oh my God.
I had a broken jaw, just waiting to see what's going to happen. I remember my father screaming on the phone, being like, he has a broken bone. We need to get this fixed, and just screaming between two insurance companies. And then finally it got approved, but it was just like, why do we have to work so hard at this?
Yes, that's so fucked. That's just so fucked. I mean, so when I had two slightly bulged discs last year, I've talked about it on the pod before, but insurance told my doctor, like, no, she has to do 6 weeks of physical therapy before we will approve an MRI, which, by the way, I still had to pay, you know, like $700 for any, like, what, if my doctor is saying, I'm pretty sure this is what's going on, and they're like, let's wait it out a month and a half. Okay, so you look like an asshole because guess what? She still has this issue. She still needs this particular set of care. So now you still have to go through with the MRI anyway. So I don't understand. Like, I think a part of it is they're putting up these roadblocks because they know most people don't have the time to bullshit around. I've got to get to work. I have to pick up the kids. I have to take care. So I think they get away with it because people just drop off and say, oh, okay, I guess I'm just going to live with this pain, or I'm going to live with this ailment. And it is what it is. Cause I can't take the time to go through all your red tape and fill out all your forms and make all the phone calls. And that's really fucking terrible. It's terrible.
I hate sometimes that physical therapy is almost always the first line.
And listen, there's nothing wrong with physical therapy. I loved going to physical therapy, and it absolutely helped. It absolutely benefited me. But at the end of the day, when my doctor is like, we need to know specifically how to treat it and what we need, we can't just go to physical therapy and hope a couple of exercises are going to solve the problem. Let's find out what the fucking problem is first. And that's just what's so crazy about it. Oh my God, I could go on for days. It
always boggled me because sometimes, like, yes, I know physical therapy has its place. It can be very beneficial.
Yeah.
PT, OT, it can be priceless sometimes. But if there's like an injury, sometimes moving certain things could further the injury, which always, like, I always thought, like,
it's a gamble.
A diagnostic being like, this happened, this is how we treat it. Yes, I know an MRI is expensive, but sometimes just knowing what's there can just cut out a ton of other stuff.
Right.
It can get you to the modality that's going to be appropriate for treatment.
Exactly. Oh my God, I could go on for days. It's so frustrating.
Oh, I know. Believe me, I feel you there.
But let's pivot. So let's talk about that. And again, I want to know how this came about as well. And it did happen during the height of COVID, I believe. But so now you are also, in addition to this nursing role that you're still very much part of, but now you're also a flight attendant for a major airline. How did all that happen?
Yes.
And please, what is that? Because I would love to, but there aren't any airlines very close to me, and I refuse to do an over an hour commute anymore. I've been there, done that. Not a fan. So. So where did this idea come from? Where did this thought that, like, maybe I'll look into this? And what was the process like when you finally said, yeah, I'd like to apply and become a flight attendant?
So as we alluded before, I did that concierge, that private care for the mega rich and famous. And I got used to flying. So my commute used to be getting up and flying across the country to, work with a client and go back home. And so I got used to being in airports and flying and not being home. And so I did that for a year, had an awesome year, enjoyed my life. But unfortunately, the company managing my contract closed, and the new company that took over the clients I was working for didn't keep me on. So I had a decision to make. Either stay full-time in the nursing career and, I could either go back to my outpatient job full-time, or do the travel nursing gig and work in understaffed facilities. And I decided, I'm like, oh, I got used to flying this airline. Let me just apply on a whim.
Okay.
And because, it was after COVID, they were trying to all the airlines were trying to ramp up their staffing because they had everybody retire after COVID, like, decimated their reserves, and they were trying to staff back up a little bit. So I was like, let me apply. I was only going to apply once. I was only going to apply to one airline, and I was just going to just go with it. And it just happened to be that from my initial application to my invite to go apply in person was only 3 days. So my application moved rapidly, and I went for my face-to-face is what we usually call in the aviation, like kind of like that, you're there meeting with it. And I was offered a CJO, a conditional job offer, and I just went with it. And so I've been doing it for almost 2 years now.
That's awesome. And what's the schedule like? Is it one of those like as needed kind of things, or do you have like a set schedule, like where you're there a couple days a week? Like again, I've talked about, my cousin has worked for an airline for the past 35 years. She has a pretty set schedule. I think she starts at like 4 a.m. or something bananas, but she's out by like 1 or 2. But she's at a desk now. She did start out as a flight attendant on, back and forth on all different types of flights, international and local and that kind of thing. So what's your schedule like right now?
So the aviation industry is very much a seniority-based industry. So it depends where you are based and how long you've been there. So fortunate for me, I'm in a very junior base for my airline. So my, 2-year seniority goes quite far. I'm able to bid the trips I want. I hold a line, which a lot of newer flight attendants usually have to go on reserve, and which means what days you're working, but you don't know what. You're kind of like told last minute where to go.
Okay.
But fortunately, I hold a line, so I know where I'm going and what I'm doing. And the schedule is very flexible because I'm in a junior base.
Okay. Well, that's good. And I mean, again, you're dealing with the general public, so very much like nursing, where, you just have to take each person as they come and just try to be as hospitable as you possibly can. But what's it like working with the general public in this kind of setting than, as opposed to in a hospital type of setting?
I feel like in this setting, I always have to be on because I'm in a metal tube stuck with these people with nowhere to go. So I always have to be on. I always have to be gracious, and, it's customer service no matter where you are in that plane. Whereas nursing, you can kind of like remove yourself from it and be like, I need to decompress for a moment and stuff like that. So yeah. I feel like that's the biggest difference, is that I'm always on when I'm on a flight, and then my decompression time is between the flights.
Okay. I just had a question and I lost it. This happens all the time, unfortunately. Sky law. That's a real thing. Yes. Have they talked to you about Sky law? Have you ever had to I don't know, not restrain anybody, but have you had to get the pilot involved and say, hey, we've got a situation and we need you to make a call? Or
there is no less than 2 times that you are reminded federal regulations require that all passengers comply with crew instructions. It is a federal law that you do what a crew member tells you. We are highly trained on the safety of the aircraft we work. So in terms of safety, because, people think of flight attendants as, I've heard the term sky waitress and stuff like that. Yeah,
cocktail waitress. Yeah, you're just here to give me drinks. Yeah.
But it's always said flight attendants are safety professionals. And to use as an example, remember when the Japanese airlines, it was an Airbus 350 that collided with the Japan Coast Guard plane and caught on fire, and they had to evacuate the plane, and there was no loss of life. Do you know how long flight attendants have to evacuate an entire plane, regardless of the size, using half of the exits? We are assuming half of the exits are unusable.
Okay.
And how long the flight attendants have to evacuate the entire plane, having everybody off.
I mean, I would think, especially in an emergency, 5 minutes max. I would imagine things can go very awry if given any more time. But you're going to tell me it's something crazy.
Are you ready for the answer?
You're going to tell me it's 30 seconds.
90 seconds.
A minute and a half to get everyone the fuck out. And again, it's not like it's just, oh, yep, everybody. Oh, okay, yeah, we know what's going on. No, it's an airplane full of people who are panicking. And all they care about is their shit and where's my, how do I, and I got to get my bag. And you're like, no, sir. And Yeah.
We have 90 seconds to move everybody from their seats safely from the exits, depending whatever exit they're using, because we have a variety of planes with a variety of exits, depending if you're like doing like a window or, you know, a door, and the doors are different sizes, if they're a small plug door or anything like that. So we have to be able to effectively move everybody from 90 seconds.
Do you get annoyed when people aren't paying attention to your little safety spiel? Because I think people have just gotten to a point where they're like, yeah, once I've heard it once and then I know it, but they don't know it. They don't know that, again, you put the mask on yourself first before you assist somebody else. The mask needs to be covering your nose and your mouth. You know, even though the bag doesn't inflate, there is still air flowing. Like I've memorized all of this stuff, but it's because I do you know, especially in my job, I've talked about it before, like safety is very much in the forefront. So I'm very safety conscious at all times. But does it drive you crazy when, like, because you're sitting there and you see all of these people and you're like, if there's an emergency, half of y'all ain't gonna make it. Like what? Like
I really worry. I worry every single flight about evacuating a plane. There was a viral video that went viral from an American Airlines flight. It was a passenger at the rear of the plane, and it was a PED fire, so a personal device. I guess it wasn't a fire, but a laptop started smoking. And the flight attendants received an evacuation command, and these flight attendants are pleading. You can almost hear in their voice like that they're like begging people, like,
the desperation.
Move forward,
please go
forward. And it's just people just like grabbing the overhead bins, trying to get their stuff. People are just standing in the aisle. They're screaming. I can just hear like the desperation in their voice. And it just makes my skin crawl, because that's what it is to evacuate a plane. Nobody cares. They're going to be like, I need my purse. I need my laptop. Being like, it is a safety concern. Get the hell off this plane.
Right. Well, it's the thing, you know, I used to work for hotels, so I've had the same thing when we have a fire drill. People are just like, it's a drill, or I don't smell smoke, and we're fine, whatever. And it's like, you don't know the circumstance, you don't know the situation. And it always cracks me up, and I'm sure you get this now too, when I watch TV shows or movies and they talk specific about, like, the number one thing we always had with the hotel was there'd be like a court case and somebody would say, you see this is your card key for your room, and it has all of the information on it about when you checked it, when you entered the room, and and all of us are just laughing in the hotel because we're like, it doesn't have any of that. It doesn't track. And it's literally, can I enter this one room? Yes, no. That's it. There's no personal information on the card. It doesn't timestamp shit. It's literally just access to one door in the building. So I'm sure you see stuff like this all the time now, watching TV, even in the nursing field as well. I remember when Catherine and Rhea were just on, they were saying the most realistic depiction of nursing or of the medical field was Scrubs. It was the most, the show Scrubs. So do you see that? Have you caught things like that now, being in both of these different worlds? Have you caught these things on TV and you just like kind of roll your eyes like, give me a break?
Yeah, I remember there was, I'm not sure if it was like can you hear me?
Yeah, I got you.
I lose it? Okay. I just wanted to make sure you could still hear me. I remember this video, I wasn't sure if it was like an Instagram reel or a TikTok, where a nurse was sitting down and she was just taking these little clips of these medical dramas. And she goes, oh, wow, a doctor is getting a urine sample, being like, yeah, that's never going to happen. But there was that Idris Elba movie, like Hijack. And I was told, like, as a flight attendant, you're really frustrated because you're like, that would never happen. That would never happen. Like the safety protocols and everything we have.
Well, I saw that film Sully. And, we're talking about the Miracle on the Hudson. And it was all of like a 30-second thing. So I went into it being like, how can they possibly make a whole movie about this 30-second experience? But they go into the investigation into, the malfunction of the plane. They look at a couple, they give you the whole ins and outs of what happened after the fact. But they kept replaying when he first said, we've got to brace for landing. And the flight attendants are all screaming, brace, 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 head down, stay down, brace, brace, brace. And you get chills hearing it, because you could, just like you said, like the panic, but also, they're trying to give these commands, and you're trying to make sure people are doing the right things. And it was one of those that I was like, if that really happened, like, I would be shitting myself in that 30-second time span. But they found a way to make it, this movie moment. And again, whether or not that really happened, they said those kinds of things, I don't know. But and thankfully, God, thank goodness, I've never been in an experience like that where I've, we've had some issue with any flight that I've been on. I'm very thankful for that. But have you seen something like, just like you said, like hijack, but have you seen anything that's like the most realistic or the closest thing to what you experience day to day, either in the nursing field or as a flight attendant, in any film or TV show? Like, has there ever been anything that you're like, okay, yeah, that's pretty close to what we deal with?
Well, even what you just said there, that is very realistic. Okay. Because flight attendants, we are trained on certain commands, and that's how you can tell which flight attendant works for which airline, because all our commands are airline specific. So,
that's
like,
really
if I were to give you mine, you'd be like, okay, that's who you work for. Because I remember I had. In my initial, so we are all, so when you're certified as a flight attendant, you go through initial qualification, and for us, it's CQ, it's continuing qualification afterwards, when you have to recert for your, cause we're certified by the FAA. And, I remember one of my, flight attendant, trainees with us, she mixed up. She came from another airline. She combined ours with another one, and it was like something like ridiculous. And I looked at her and she goes, "I'm so sorry." She had combined two evacuation commands, because you get used to, like, you say it in this specific set based on how the captain tells you. So we have, the captain says a certain command, we have a certain command as a response. Okay. So we're very highly trained on evacuating planes. That is our big thing. How it is, service is a nice thing, but at the end of the day, we are there for safety.
So we didn't get into that too much. How long is the training process? Because I would imagine not only do you need to, like you said, learn the specifics to your airline and the different commands and the codes and just the standards in place and how they do things, but you still also need to know the laws and the regulations and all of that stuff. So I would imagine it's a lot to take in. It's a lot to process. It's a lot to retain. How long is that training process? It's
different for every airline. And there's two major, groups of airlines. There are what you think of like the big four: Southwest, Delta, American, United, and they're all the legacy
carriers. Is Southwest considered a big one? That's a big one?
They are. They're part of the big four. Southwest,
I never
Delta,
would have.
United, American.
Okay.
Yep. They're the legacy carriers.
Okay.
Everything else is not a legacy carrier. But what they have in common is they're mainline. They are a major carrier. Then there are regionals. So kind of like Endeavor, PSA, Mesa, SkyWest, those are regional carriers. They kind of do like the shorter trips for the main line. They usually have, smaller planes that do smaller routes. So it depends which airline you work for. Okay. I work for a main line. We have a lot of planes. We have a longer training, so it's just under 2 months.
Okay.
To go for training. And this is like 6 days a week.
Right.
For almost 2 months.
Right. I mean, that makes me feel good, though. I would rather you be, you know, immersed in your training. You'd know it before you get on, especially because, like you said, in that situation, anything could happen at any point. You never know how a flight's going to go. If there's a mechanical issue, if there's an issue with one of the customers or guests, whatever you want to call it, on the flight. So that's reassuring to know you guys at least have that kind of training. And, you know, it's not like McDonald's where they throw you on the register on your second day. So that's good. They're not just putting you on a plane and saying, here, kids, serve drinks. So that's really good.
Yeah. And it depends, you know, on your airline, but there are very strict guidelines by the FAA about, you know, how our test results have to be. Like, we have to maintain a very high average on all our testing. And you need to exemplify, you know, proficiency with all these drills and stuff. And you only get a few chances. So if you mess up, you know, like once, twice, like you're maybe given that third opportunity. If you can't do it by the third time, sorry, you're done.
Okay. Well, that's good. I'm a big proponent of adhering to standard and to living by standard. So that sounds fine with me. Well, we covered a lot of things here. And like I said, I've been trying to get you on the show for a while. So I do really appreciate you taking the time, but I will let you go. Again, you guys, this was my friend Bryan. We'll definitely catch up again and talk some more, because Lord knows I can talk insurance all day. I can, and I do, you know, I do love.
Me, I'm right there with you.
I do love crazy customer stories too. But you guys, this was Try Not to Curse. I am Elizabeth Marvel, and we will catch you next time.